your question. Okay, so if you have read and understood, considering it surgical anatomy station, kindly please begin.
Yes, ma'am.
Yes. If you are looking at the image in front of you, can you tell me how would you divide the triangles in the neck?
Oh, yes, ma'am. Yes, some mandibular triangle, some mental triangles, some mandibular triangle, and
First, broadly divide them into two, anterior
anterior,
triangle and
anterior,
posterior triangle.
anterior and posterior triangle.
Yes, good.
And the anterior triangle is divided further by digastric muscle and omohyoid muscle. The anterior to digastric muscle, the anterior belly of digastric muscle is some anterior triangle, and posterior to the digastric some mandibular triangle. And there is below there is a posterior belly, there is anterior belly of omohyoid, which divides further this triangle into anterior and posterior. The anterior is a muscular triangle, and the lateral is
Which
carotid
one?
triangle.
Yes, if you are looking at if you're describing anterior triangles, can you describe number 13? Which triangle is this?
This is submandibular triangle.
All right. What about number 11? Which one is?
Number This is submental triangle.
Yes, good. And number 8?
Number eight is this is muscular triangle.
Okay. Number 2, which triangle is this?
This is carotid triangle.
And what is number 1? Which muscle is this?
This is digastric, posterior belly digastric.
Okay. And if you can identify number 12?
This is anterior belly digastric.
All right, good. Can you please identify number 4?
Number four is the sternocleidomastoid,
Yes.
the two
Please
heads.
tell me the origin and insertion of
Or
sternocleidomastoid and nerve
origin
supply,
is from
please.
origin is from the mastoid process of the occipital bone,
Yes.
skull,
Yes.
insertion by the two heads, sternal heads and clavicular head, and its nerve supplies by the accessory spinal nerve, 11th spinal nerve.
Okay. What is the mode of action of this muscle? What does it do?
This muscle is uh, uh, that it will move the head against the resistance, like if
Okay,
you
good.
ask the patient to have left.
Right. And the posterior triangle, please tell me the contents of the posterior triangle, number 3.
Number three is the muscles in the posterior wall of base of the posterior triangle,
Yes.
and it includes the splenius capitis and uh, uh, and ma'am, can I answer this later?
Okay, we'll come back to this one later. All right. Can you please identify this structure F and E?
This is a yes, thyroid gland,
Yes,
and E is the isthmus of thyroid gland.
isthmus. So, can you describe the thyroid gland? How many lobes there are, and how does it look like, and where exactly is it attached? Where to where?
Thyroid gland, yes, it is a pyramidal shape organ. It is present in the anterior part of the neck,
Yes,
and it is has a right and left lobe, and
yes.
in front and in the middle it has the isthmus, which joins the right and left lobe. Isthmus is present in front of the second to fourth tracheal ring.
Okay,
and
good.
it is enclosed with the pretracheal sheath.
All right. Okay. Can you please identify number A?
A superior thyroid artery.
Okay. Can you tell me the blood supply of the thyroid gland?
So it is supplied by the superior thyroid artery, and which is a branch of external carotid artery, and inferior thyroid artery, which is a branch of thyrocervical trunk. And so further is a branch of subclavian artery. And then in 10% of cases, there is one extra arterial pipe, is thyroid ema artery, which is arising from the brachiocephalic trunk.
Okay, good. Right. Moving on. Can you identify number 11?
This is an external jugular vein.
Okay. How is it formed? Can
It
you
is
tell
formed
me the
by
landmark, anatomical landmark of it?
it is present in the posterior triangle between the first of all, it's found between the mastoid processes felt, and then the lateral border of the sphenocytospermastoid, as well as the two heads of the insertion of sternocleidomastoid muscle. And there is also felt the pulsations of carotid muscle. It is present lateral to the carotid muscle.
Okay. Can you tell me where, or if you can identify external carotid artery in this image? Which number?
This is 22.
Okay. Can you tell me what are the structures which are closely related to its bifurcation?
Structures only related to bifurcation. That is right. Can I answer this later?
Okay. Can you tell me what are the clinical significance of injuries which cause to the external carotid artery or and to internal carotid artery?
External carotid arteries it supplies the face and the occipital lobe and all the external structures. And the internal
Clinical
carotid artery
significance.
is but the
Okay, we
internal
can. Yes.
internal carotid artery it supplies the brain inside. And the clinical significance, if there is a thrombus or clot, may result in the stroke and present a
Okay.
symptom.
We can come back to that later. Right.
Yes.
Please, can you tell me thyroid gland? What about the recurrent laryngeal nerve? This nerve supplies which part of the neck muscles, or what does it supply?
It supplies the all the muscles of the larynx except the cricothyroid muscle, which is supplied with external branch of superior laryngeal nerve.
So if a
And
patient, yes, recurrent laryngeal nerve gets damaged because of thyroid surgery, how would the patient present?
a patient may present with hoarseness of voice
Yes.
if there is a recurrent laryngeal nerve injury, and there is two types of injury. There is a partial injury and there is a complete injury. And if there is a uh, partial injury, the patient may have difficulty in breathing, stridor, and cough. And if there is a complete injury, the patient may be having a hoarseness as well as the dyspnea.
Okay. Can you tell me which nerve is susceptible to injury with the thyroid, with the vocal cord surgery? Last question, bell is gone.
When there is the surgery, it is the recurrent laryngeal nerve. It can be injured.
And with the surgery of vocal cords?
Uh, it's a recurrent laryngeal nerve, or critical that superior laryngeal nerve.
Yes, now you're getting it. Good, thank you.